In this video, we are going over special tests for hip flexor strain injuries. So, conditions like femoral acetabular impingement syndrome are often misdiagnosed as hip flexor strain injuries. So it's important that we can differentiate between different pathologies. However, hip flexor strain injuries are real, and the way you treat that is a little different than something like an FAI. So it's important that we just have good tests to make sure that we're treating the right thing. My name is Dan Pope. I'm a cash-based physical therapist, personal trainer, and coach. I love all things strength and fitness. At Fitness Pain Free, we're trying to level up your game as a coach and clinician. So hip flexor strain injuries usually occur after some sort of traumatic event. So think about I'm trying to kick a soccer ball as hard as I can. All of a sudden I feel sharp pain within my hip. If you have some sort of pain that's a gradual onset, I'm not really thinking of a strain injury, right? Usually these are really acute. The other thing you might see with a strain injury is some sort of deformity. So when you palpate, there might be a difference in the way the muscle feels side to side, or there might also be some bruising, right? The other piece is that folks that have strain injuries can often put their finger right on where the pain is. If someone is dealing with, let's say, a joint issue, something like FAI, oftentimes it feels deep to the hip somewhere, right? You can't necessarily put your finger on the pain. The three most common hip flexor strain injuries are going to be the rectus femoris, the iliopsoas, so either the iliacus or psoas major, as well as the sartorius. So one of the ways to help to rule this in is by doing palpation, right? So what I'm going to do is look at the hip right here. I'm going to find my landmarks. So essentially I'm looking for ASIS right in this area. Let's have you come in just so you can see exactly what I'm doing here. ASIS, and if I go straight down to the knee, my rectus femoris more or less lies right in this area here. So if I palpate right in this area and I'm feeling the rectus femoris and the patient's like, yeah, that kind of feels like my pain, that would be a positive special test. Now, if I'm thinking it might be more of the sartorius, sartorius actually attaches to ASIS, comes down and wraps around the inside of the knee. So right next to the rectus femoris is going to be the sartorius. So someone is reproducing their pain by palpating here. I'm starting to think, all right, maybe the sartorius is involved. And the last muscle you can palpate is going to be the psoas, and that's just medial to the sartorius. So it's basically rectus femoris, sartorius, and as you start to go a little bit more medial to that, you're palpating the psoas. And if that reproduces the patient's symptoms, you're starting to think, okay, this might be a hip flexor strain injury. Another way to help you diagnose hip flexor strain injuries is through resisted testing. So hip flexors, obviously, they flex the hip. So if I resist that motion and reproduce the pain, we're starting to think this might be hip flexor strain injury. So the first test we're going to do is a 90-90 hip flexor test. So obviously your patient's just sitting at the edge. We're 90 degrees at the hip, 90 degrees at the knee. I'm going to put my hand right above the knee and have you push up into my resistance. Does that reproduce your familiar symptoms? All right, hip flexor strain. Next test we'll do for hip flexor strain injuries is going to be resisted hip flexion in a Thomas test position. So let's have you go into a Thomas test position here on the edge. Just scooting off, scooting off, scooting off. Lay all the way back. Let's have you bring this side knee towards your chest and then hold on to it. From here, relax this leg and then push straight up to the ceiling towards me. Does that reproduce your familiar symptoms? Okay, so if it doesn't reproduce the familiar symptoms, maybe we're starting to think this is not a hip flexor strain injury. If you're interested in the sensitivities and the specificities, here's the study here, right, with the sensitivities and specificities. So pause the video if you'd like to read them. And if you're enjoying this video so far and you want to learn more, there's another video right here I recommend clicking. Thank you very much, guys, and I'll see you on the next episode.